Love Living at Home member, and I'm also a HICAP, which stands for Health Insurance Information Counseling Assistance Program counselor based at Lifelong. I'm sure many of you know Lifelong, the senior center here in Ithaca. And we have a bunch of counselors. We all go through certification through New York State. This is a New York State program. So we go through, as Robin can tell you, because Robin and Ed are doing the training now, you go through some pretty extensive training. And then every year to get certified, and then every year we have to take an exam to be recertified. So we're keeping up with the latest information. So today I'm going to start my slideshow here. We're going to be doing a Medicare Basics session. Now, I assume that almost everybody here is probably already on Medicare. So I'm going to skip over the very basic slides about this is when you're eligible for Medicare, this is how you sign up for Medicare. If there's anybody that wants that information, it is in the slide packet that you will be getting from Cheryl. You can ask Cheryl to send you the slide packet. But I figured we don't need to go through that level of detail right now because everybody in this group should already be on some form of Medicare. But I am going to go over some of the basics that might already be familiar to you, some that may not. The reason that this is really good timing to do this session right now is because we are getting close to the fall open enrollment period. And every year from October 15th to December 7th, you have an opportunity to change your plan. And we're going to talk about the various plans, the differences between original Medicare, Medicare Advantage plans. We're going to talk a little bit about the Part D prescription plans and the Medicare supplement plans, just to kind of give you a whole overview of that. And if you remember nothing else, and this is in the slides at the end, just remember that HICAP is here to help you. We have one-on-one counseling, confidential, unbiased counseling. There's nothing in it for us to push one program over another. And you can call, and there's information at the end of this, you can call to set up an appointment. Right now, most of our appointments are being done via Zoom or by telephone. During open enrollment, we usually have walk-in clinics, and usually actually pre-pandemic, we were available every Wednesday year-round from 9 until noon, where you could come in and meet with us. And then during the open enrollment period, we had extra hours, and we also had walk-in clinics where people could just walk in and wait for their turn to meet with somebody. Obviously, we're operating in a slightly different environment right now. So we are going to have a very small number of walk-in, or not walk-in, but appointments in person during open enrollment for people who want those. But the majority of what we will be doing is via Zoom, via the telephone. I've been doing it all spring, ever since we shut down in March, and it works surprisingly well. Not quite the same as having somebody sit right next to you and give them all the handouts and things, but it's been working okay for the time being. So I'm going to cover a lot of stuff today. If you could hold your questions to the end, that would be great, and we can go over them then. However, if I'm really confusing you halfway through and you just have to burst in and ask a question, feel free. Just remember to re-mute yourself, please, when you're done. So let me start the slideshow and we will get going. Okay, I've already introduced myself to you, so you know who I am. And again, this is our address down here, but at the very end, I will give you all the information for how to get a hold of our coordinator to make an appointment if you want to. All right, so Medicare. Often when we talk about Medicare, it can seem like a maze. And especially at this time of year when people get inundated with all these mailings about, different Medicare Advantage plans and different Medicare supplement plans, and there's all kinds of ads on television. People get very confused about what their options are and what they should be choosing. So hopefully this session will just give you some overview on all of those various options. Not going to talk about the big picture. Well, I will talk about the big picture a little bit. We're not going to talk about the first couple of bullets here. You're already on Medicare, most of you. You've already
sorry, Deb, are we supposed to be seeing a PowerPoint presentation? I'm not seeing this. Is it just not me?
Sorry. Yeah, no, it's not just you. You know what I forgot to do? Thank you, Robin. How about, oh, I'm sorry, not Robin. Let me make sure I'm
Uh,
sharing the screen here. Okay, let me go back to my, there we go. Now, there you go. Now can you,
yes, we're, yeah,
okay, sorry about, I keep, no matter how many times I do this, I forget to actually share the screen. Thank you. All right, so big picture today. Again, I'm not going to talk about what Medicare is and who's eligible. You should all know that. And you don't need to know when to sign up. But we are going to talk about the various parts of Medicare again, just to cover again what those are. Specifically, we're going to talk about the difference between original Medicare and Medicare Advantage plans. And then I'll also talk a little bit about assistance for paying for Medicare. Oops, come on. What you doing, guy? Oh, come on. All right, let's go down here. All right, so you know what Medicare is, so we can skip over that one. You know eligibility, so I'm going to skip over that. But okay, so let's start here with the core pieces of Medicare. So there is Medicare Part A and Medicare Part B, which I'm sure most of you are familiar with. Part A for most people doesn't cost any, there's no monthly premium if you've worked more than 10 years. Part B, which is your medical insurance, and we'll go over each of these parts in more detail. There is a monthly premium, changes a little bit each year. As of right now for 2020, it's $144.60 a month. And again, all of you should be familiar with that. That's income dependent. If your income's higher, you might have a higher premium. If your income is lower, you may have a lower premium. Usually people have this taken from their Social Security check. You can also write a check to Medicare. We do not have the 2021 figures yet, so we don't know how much that premium is going to be going up in the next year. Part A and Part B, you should probably all know this as well. It does not pay for all of your costs. A lot of times when we have people coming new to Medicare, they think, oh, Medicare, great, I'm going to get this card and I don't have to pay anything. Obviously, that's not the case. There are deductibles, there are co-pays, there are co-insurances, what we call out-of-pocket costs. So let's talk about Part A a little bit. Medicare Part A is your hospital insurance, and it will help you pay for inpatient hospital care, but you must be admitted. And that's a slightly tricky thing because you can go into the emergency room and the doctor might keep you all night. The doctor might even decide to put you into a room. But if they do not formally admit you, Medicare does not cover that expense. So you have to make sure that you've been formally admitted, and you can ask the doctor that. There's actually a form they can fill out. Most times you are admitted, but people are sometimes surprised by that to find out that they were not admitted. So you can't just be under observation, you have to be admitted. Medicare Part A also helps with inpatient skilled nursing facilities if you've spent 3 days in a hospital. So for instance, if you fall and break your hip and you're in the hospital, you have surgery for a hip replacement, you're in the hospital more than 3 days, after you get out of the hospital, often you'll end up in a rehab facility like Beechtree or Oak Hill to have some rehabilitation, some occupational therapy. In that case, Medicare, and we'll talk about those specific costs in a little while, Medicare will pay part of that for you. They'll cover part of that for you. What they don't cover is long-term custodial care. So if you reach a certain age and you just can't stay home anymore, you need a nursing home for full-time care, that is not covered by Medicare. And some people find that to be quite a surprise. They don't expect that. Home health aides, again, if you are considered homebound, and homebound doesn't mean you never can go out, but if you need assistance getting out, like a walker, a wheelchair, and you're mostly homebound. So that means you can go to a doctor appointment, you can go to church, you can go get a haircut, you can even occasionally go to a special occasion like a graduation or a wedding or a funeral. But you pretty much have to be at home. You can't be bouncing out every day. Not that any of us are doing that right now, having lunch with friends and doing things like that. If your doctor considers that you need some skilled help at home, and again, this is short term, this is not 24-hour care, and it's not long term, You can get some coverage for that, home health. And they will come in. This is things like helping you bathe, helping you dress, not necessarily doing housework and laundry. So again, not someone coming in just to clean for you, but someone that comes in to help you. You can get that covered by Medicare Part A. Part B will also pay for that if you haven't been hospitalized. For Part A to pay for it, you have had to have been hospitalized, and you have to start receiving the help within 14 days of your hospitalization for them to cover that. But in some cases, Part B, if your doctor says you need help, even though you haven't been hospitalized, but you need some short-term help, maybe you've got a bandage that needs changing or you need help with something else, then Part B will come in and pay for part of that as well. And also hospicare help. Medicare will cover and help with hospicare help from time to time too. So that's kind of, and we'll go over this in a little more detail, but that's just kind of umbrella-wise the kinds of things that they cover. Now, Part B, which I'm sure, again, you're familiar with. Part B, I should also say, let me go back just 1 second and say one thing aside from long-term custodial care in your home and housekeeping in your home, Medicare does not, Part A will not pay for meals delivered to your home. So we're very lucky to have Love Living at Home, who has helped a lot of their members out in that regard, short term. But that is something also not covered by Part A. Okay, so what does Part B cover? Outpatient services. I'm sure you're all familiar with this, going to your doctors, having an x-ray, if you have to take an ambulance to the hospital, preventative services, again, like x-rays, blood work, mammograms, anytime you're doing an outpatient type of procedure like that. They also help cover the costs of durable medical equipment. So these are things like wheelchairs, walkers, oxygen tanks, things that you need at home. They can help out the cost of that. Again, some home health care. If you haven't been hospitalized, Part B will cover that if your doctor thinks you need some short-term health care. And physical therapy and occupational therapy. So again, if you end up in rehab, or even if you're not in rehab, if you're home but you've hurt your back and you need to see a physical therapist, Part B will help pay for some of that. Now, what does Medicare Part A and Part B not cover? They don't cover prescriptions. As many of you know, if you're already on Medicare, you need a separate drug plan, a Part D drug plan if you're on original Medicare, and we'll talk about that later. They don't, as I said, cover long-term care. So if you end up in a nursing home or you want 24-hour aides because you can no longer take care of yourself in the long term at home, they don't cover that. Dental, they will not cover dental, vision, or hearing. They don't cover any of that, but Medicare Advantage plans do cover some of that, and we'll talk about that in a little while. Now, for dental, if you were in a car accident and you had some teeth knocked out and you needed implants, then Medicare might step in because that's considered medically necessary. You would think good dental care is medically necessary. You would think your eyesight is medically necessary, but for the most part, they do not cover those services. They don't cover cosmetic surgery or acupuncture, and they will not cover your visits to the podiatrist, again, unless it's a medically necessary, something is wrong. So routine foot care, also not covered by Parts A and B. You don't need to know when to enroll. So I'm going to skip over these bits. Okay, we talked about Parts A and Part B a little. I'm going to go into those in a bit more detail in a minute. But also, as I said, there are two ways to get Medicare. There's original Medicare, which is your Part A and B that we talked about, and we'll go into that again. And then there's Medicare Advantage plans, and these are the ones that you usually get all the mailings for in the mail, or you might see them advertised on television. And those can be a really good option for some people. They have more predictable costs. They cover a little bit more than original Medicare does. But one thing that always throws people is regardless of which choice you go with, original Medicare or a Medicare Advantage plan, you have to enroll in Parts A and B. You have to pay your Part B premium, even if you end up purchasing a Medicare Advantage plan. And the reason for that, and it confuses people because people will say, well, I'm not on original Medicare, I'm on a Medicare Advantage plan. Why do I need to have why do I have to pay for Part B? The reason for that is originally, all we had was original Medicare. And as you'll see in a couple of minutes, original Medicare for some people just doesn't work very well. There's no out-of-pocket maximum. If you end up with really high costs, you can end up paying a lot of money. It doesn't cover some things like dental, vision, and hearing. So quite some time ago now, the government came up with a plan to give people another choice, and that was the Medicare Advantage plans. These are sold by private companies. However, they are federal programs. They're subsidized by the federal government. The Medicare Advantage plans have to give you absolutely the same thing that original Medicare covers, plus a little more in most cases. And as you'll see in a minute, the costs are a little more predictable. Sometimes they can be a little lower. But because the federal government is subsidizing these insurance companies to offer these Medicare Advantage plans at a lower cost, you still have to pay your Part B premium. So that's why. The Medicare Advantage plans are called Part C. I've never heard anybody refer to Part C Medicare, to be honest with you. I've been doing this for a few years now, but officially that's what they're called, but everybody knows them as Medicare Advantage plans. The other big advantage, as we'll see in a minute, to a Medicare Advantage plan is they include your prescription drugs. So you don't have to have a separate drug plan. So again, Medicare, original Medicare, as we started talking about before. Part A, hospital insurance. Part B, medical insurance. As I said, there are out-of-pocket expenses that you will have. Original Medicare is available nationwide, and the great thing about that is almost every doctor will accept Medicare across the country. Almost every doctor does. So you can travel anywhere in the United States. And we often tell people, if you're thinking of living part-time in Ithaca, part-time in California or Florida or someplace else, then it's better to get original Medicare, because original Medicare is accepted everywhere across the board, not just in your specific region. So accepted anywhere. As I said, there's no maximum out-of-pocket. What I mean by that is usually Medicare, the hospital costs are a little different, but for the Part B, for going to your doctors, getting x-rays, that kind of thing, they cover 80% of your costs, and you pay the other 20%, which sometimes isn't bad. But if you end up with a catastrophic illness and you're really racking up a lot of expenses, you're racking up a lot of time in the hospital, a lot of doctor visits, blood tests and x-rays and blood and whatever, that 20% can add up really fast. And there's no bottom to that. There's no bottom. You just keep spending, spending, spending. So there's no out-of-pocket maximum, but we'll talk about a way you can get around that a little bit. And as I said, they do not cover prescriptions. So you have to have a separate plan, again, sold through a private company to get your prescription drug coverage. So what are you paying? For Part A, what are your out-of-pocket expenses looking like? Well, if you have to go in the hospital, and as we said, Part A is for hospitalization. If you have to go into the hospital, and you have to be admitted, remember, you have to be formally admitted. Up front, you have to pay $1,408. That's your deductible. That is not a yearly deductible. When we talk about deductibles with insurance, we often think of a deductible as a yearly deductible. This is what Medicare calls an event deductible. And what that means is you pay your $1,408. So say you're in the hospital for, 5 days. You pay your $1,408. You come out of the hospital, and a month later, you're back in the hospital. You don't have to worry about that $1,408. You've already paid it. That $1,408 is good for 60 days. But if you are in the hospital in January, and then you turn around and you're in the hospital again in August or September, you've got to meet that $1,408 deductible again. So there's only a certain amount of time that deductible is good for. So if you're hospitalized twice in 1 year and those are spaced out beyond those 60 days, you can end up paying that deductible more than once. So that's an important thing to remember. So you pay your $1,408 up front. right? Once you've spent that much money down, your first 1 through 60 days after the 1408 that you're in the hospital, you don't pay anything for. Medicare goes ahead and pays that. If you have to be in the hospital past 60 days, and we always used to say no insurance company lets you stay in the hospital past 60 days. Unfortunately, with COVID, we are now seeing people in the hospital for a very long time. If you're in the hospital for 61 days up to 90 days, then you have to pay $352 a day that you pay. After that, if you're in the hospital more than 91 days, then you have to pay $704 a day. And you only have what they call them lifetime reserve days. And there are 60 of those days over your lifetime. So you only have 60 days after you've reached this, this 90 days where you pay $704. If over the course of your lifetime, for some reason, you've been hospitalized for a very long time, again, and you're reaching that point where you have to pay $704 a day, after you've done that for 60 days, anytime throughout your lifetime, then you're responsible for the full cost of your stay. Hopefully that does not happen to many people, but that is, again, something to know about. And this is why I say, for some people, original Medicare, it can be very expensive if you end up with a real problem. Now, your Part A, as I said, it'll pay for once you hit that 1408 for a regular hospital stay when you're not in for more than 60 days. They will pay for your hospital room. They'll take care of all of that. They will not pay for private duty nursing. They will not pay for your television or your phone in your room. And they will not pay for a private room unless it's medically necessary. If you have to go into isolation, then they will pay for a private room. But those other little expenses, you have to pick up yourself. Part B will kick in and pay if you see a doctor while you're in the hospital, but you don't have to worry about that. So the different parts pay for different things. The main thing to remember, that deductible of $1,408 is only good for an event period, not for the entire year. And at some point, if you have a long term, the longer you're in the hospital, the more your costs may rise. For skilled nursing facilities, if you have to go into a nursing home, so as we said, if you broke your hip and you have to go into a nursing home, you can have up to 100 Medicare covered days, assuming your doctor agrees that you need to go into a skilled nursing facility. In order for Medicare to pay for that, you have to spend at least 3 days, and that means 3 midnights. That means staying overnight 3 nights for Medicare to pay for your first 20 days totally in a skilled nursing facility. There's no deductible in the nursing facility, so you don't have to worry about that. But you do have to have been in the hospital for 3 overnights, and then they will pay for the first 20 days. For days 21 through 100, if you stay for the rest of that 100 days that you have covered, you are responsible for a coinsurance that you have to pay. I don't have that figure right in front of me, but you do have to pay a certain amount after that first 20 days. So that's Part A. Part B, as we said before, outpatient, doctor visits, those kinds of things, x-rays, that kind of thing. So what are your out-of-pocket costs for Part B? Well, right now, as we said, the standard premium is $144.60. Probably will go up in January, but we don't know how much. And as I said, some people with higher incomes, if you're a single person and your income is over $87,000 a year, or if you're a couple and your income is over $174 a year, then you're going to pay higher Part B premiums. And that's based on your salary, your income from 2 years previously. Part B has a deductible, just like Part A does. But this is an annual deductible, not an event deductible. So your annual deductible for Part B is $198 this year. We don't know if it's changing in 2021. But once you've paid that $198 out of pocket, once you've met your deductible, you typically pay 20% of any Medicare approved amount. That's usually what you pay for your Part B coverage. Oh, that time it worked. Okay, so So what happens when you're suddenly getting all these expenses? What happens if you're in the hospital a long time and you say, I can't, how can I afford this 20%? Well, there are a couple of different things you can do. As I said, with original Medicare, to cover some of your expenses are going to be A and B that we talked about. And then you're going to have to get a prescription drug plan, which we'll talk about in a little bit. But you can also get a supplement plan, or what they call a Medigap plan. And depending on the plans, again, sold by private insurance companies, depending on the plans, there's a variety of different plans with different coverage out there. And as with anything, the more you pay, the more you get, the more you pay for it. So we'll look at some of those plans in a minute. But you can get these plans. They have a high enough monthly premium. They're not super inexpensive, but if you go with the top end plan, it'll pick up most of that 20%, most of that additional hospital coverage. So a lot of people, when they want to stay on original Medicare, will get a Medicare supplement plan to go along with that. You don't have to, but a lot of people choose to do that. And then, of course, you do need to get your drug plan as well. So the supplement plans are also called Medigap plans. Again, they're sold by private insurance companies. They have a monthly premium. The levels, you'll see in a minute there, like I said, there's several different plans and they're alphabetized. So it's plan A, plan B, plan C, plan D. And they're standardized by the federal government. So what that means is 5 different insurance companies can be selling a plan A for a Medicare supplement plan. And 5 different insurance companies can charge you 5 different monthly premiums. But every single plan A has got to cover the same thing, despite the difference in cost. So they are standardized. So here's an example. You can see here, we've currently got a few plans. Some of them have already been dropped out. And actually plans C and F, if you were over 65 before 2020, you're still eligible to purchase these plans if anybody is selling them. And they decided they're not offering them to new enrollees now. But if you were eligible, if you were over 65 before 2020, you can still try to purchase one of those plans if they're available. But as I said, each plan offers a little something different. So plan A, for instance, they will pay your co-insurance and your hospital costs up to an additional 365 days after your Medicare benefit is used up. They will pay that 20% of your Part B premium at 100%. If you need blood, they will pay for the first 3 pints of blood. They pay for if you go into hospice, if you've been admitted into hospice, they will pay that, any co-insurance or co-payment for that. They do not pick up, remember I said the first 20 days on original Medicare, your costs in a nursing home are covered. If you're in the nursing home, what we call skilled nursing facility, for more than 20 days, you have a copay. Plan A does not cover that. They also don't pay for your Part A deductible or your Part B deductible. Any excess charges, that is, if there's a doctor who does not accept Medicare assignment, they can sometimes bill you higher. That doesn't come up very often, but they don't cover any of that. And they don't cover any foreign travel emergencies. You go to Plan B, the only thing they add on is they will cover your Part A deductible and so on and so forth. So you go up and up. Plan F was always considered the Cadillac plan because, as you can see, if you look down the column here, it covers the most of anybody. But as I said, Plan F, not a lot of companies are selling that anymore. We actually found Plan G, and actually one of my clients discovered this because he was good at math. And he said, well, you guys are saying Plan F is the Cadillac plan, but actually Plan G is more cost effective because the only thing Plan G doesn't cover that Plan F covers is your Part B deductible. But your Part B deductible is $198. It was less when he was looking at it. And the cost of a Part F, the cheapest Part F plan, was more than $198 a month. So he said, why wouldn't I just get a G? And I'm like, yeah, you're right. So fullest coverage would be with Part G that you see here. And the prices, as I said, vary widely. And we'll look at those, some examples of those in a second. But a few facts about buying a Medicare supplement plan. Again, you can use this with any provider in the US. Basically, all it does is it pays that extra, depending on what you get, it pays those extra amounts. So if you move to a different state, as with original Medicare, the plan goes with you. So Medicare goes with you, your Medicare supplement plan goes with you. I talked about the fall open enrollment period when you can get a new plan, change your mind about things. There are only certain times of the year when you can either enroll in Medicare or change your plans. But with a Medicare supplement plan, at least in New York State, there's a continuous open enrollment. So you can sign up for a Medicare supplement plan anytime you like. If you have a pre-existing condition, you may have to wait, sometimes up to 6 months, to get accepted onto a plan. But again, in most cases, that's not a real big issue in New York State, particularly if you have had prior credible coverage, insurance through Medicare or whatever, within 63 days before you sign up for a Medicare supplement plan. Usually that pre-existing condition is waived. So that's usually not a problem. In this state, every state does things slightly differently, but if you purchase it in New York State, that's not as big a problem. So some sample Medicare supplement costs. Now again, these are for 2020, and you'll notice they're for Tompkins County. Every county has a slightly different price point. So, and every state obviously has different price points. And these are figures for Tompkins County, again, 2020. They can change at any time because they're private insurance companies. So the monthly premium for the Medigap Part A, or Plan A, which again is pretty much the bare bones one, the one that offers you the least, those monthly premiums range from $136.50 to $253.94. Again, they have to cover exactly the same thing. It's just different insurance companies charging you different prices. And we often have people say, well, why on earth would anybody pick the $253 one if they can get it for $136.50 a month? Why would you do that? It's because people have an emotional attachment to the companies they're used to dealing with. We have a woman come in every single year without failure during open enrollment, and she has a Medicare supplement plan, and she'll always say, I'm spending too much money. I've got to figure out a way to save money. And we'll sit down with her and we'll go through everything. We'll say, hey, here's a plan that works better for you. It'll save you money. And inevitably, every year she walks out with the same plan she came in with. Because she's like, no, I trust this company. I know this company. So I'm like, okay. But the pricing means nothing in terms of what you get for coverage. Plan G, which right now, in the absence of, since F it's available if you can find a company selling it, but Plan G is now kind of considered the most coverage you can get. Those monthly premiums right now range from $184.70 a month to $412.30 a month. So you can see how you've got your $144.60, depending on your income. Most people pay $144.60 for their Part B premium. Then you have a drug plan premium, which we'll discuss in a minute. And then if you decide you want full coverage and you want to make sure that you're not paying any of your 20% out of pocket, or as little as possible, then you've also got this supplement plan that you're going to also be paying for every month. So it can stack up. It can stack up pretty quickly. Now the drug plans, as I said, these are sold by private insurance companies, and they are region specific. So if you move, you're going to want another drug plan elsewhere. You can enroll I hope everybody on this Zoom meeting has got a drug plan. Often we will have people come in, especially when they're enrolling in Medicare for the first time, and they'll tell us, I don't need a Part D plan. I don't take any drugs. I'm healthy. I don't take any prescriptions. Maybe I have an antibiotic once every couple of years if I get something. I don't want to pay a monthly expense. Well, there's two reasons you should never think that way. Number one is if you do not enroll in a drug plan when you're first eligible, there will be a penalty that you have to pay if you have not got credible coverage elsewhere. And it has to be credible. What they define it as credible coverage, and you need a document proving to Medicare that it's credible coverage. Otherwise, you're going to be paying a penalty every year for the rest of your life. It's not high, but it's still a penalty every year for the rest of your life. And the other reason I always tell people is you never know. Life, as we found out this year with COVID, life comes at you fast. You can be the healthiest person in the world. My father was never sick a day in his life, never spent a night in the hospital, looked 15 years younger than he was. But when he was in his early 80s, he got leukemia. Luckily, he had a prescription drug plan, although he never took any drugs. And once he had leukemia, luckily there was a drug that treated it very well. It was a chemotherapy pill, basically, but it was $75,000 a year. And that was over 10 years ago. That was like 15 years ago. So you never know when something's going to hit. And you can't just then decide, oh, I'm going to go out and get a drug plan tomorrow because now I found out I have an expensive drug. You have to wait for an enrollment period in order for you to get that drug. And until then, get that coverage. And until then, you're paying out of pocket. So you don't want to do that. If you don't have a drug plan, come talk to us. You will have a penalty you have to pay, but everybody should have a Part D plan. And you can apply for those online. And just like during open enrollment period, from October 15th to December 7th, you can come in and change your drug plan if you don't like what you have, and we can help you with that. So in New York State, these are statewide in terms of their expenses, their costs. So the premiums, again, sold by private insurance companies. Different companies will give you different coverage. Some have deductibles, some don't. Some charge you more for your monthly prescriptions, others don't. Some of your drugs might be in their formularies, some are not. And that's why it's always a good idea to make an appointment with us, and we can help you go through that. You bring in your drug list, now we're doing it online, but if you're comfortable sharing your drug list, we've got a website we can go into, plug everything in, compare the various plans in New York State, find the best one for you with the best coverage. But you can see, again, the premiums range broadly, anywhere from $13.20 a month all the way up to $91.20 a month. Some plans have no deductible. Some plans you don't pay a cent for. Others are up to $435 a month. A year, a deductible. So some you do have a deductible, some you don't. They all vary. And again, that's where we can really help you. So just to summarize, original Medicare is your Part A and Part B. You've got that red, white, and blue Medicare card. If you want a supplement, a Medigap, to help you scoop up at least some, if not most of the costs that you're paying out of pocket with Parts A and B, you can get a Medigap policy, and then you have a second card that pays the rest of that. Medigap policies do not cover any prescriptions. It's just your Part A and B expenses. And again, both of these cards will be accepted at any provider who participates in Medicare across the country, which is just about anywhere. If you get a drug plan with original Medicare, then you have a third card, and that's the card you take to your pharmacy. And again, we have all kinds of details on both the drug plans and on the Medicare supplement plans that we can walk through with you. Then your other option is Medicare Advantage plans, and these have become very popular. These are sold through private insurance companies, and they provide, again, the same exact coverage for Part A and B benefits. But they almost all of them, and I think all of them we sell here in New York, or we don't sell them, but they're sold for Tompkins County, all of them include drug coverage, which is nice. So you don't have to go out and get a separate drug plan. That's included in the cost of your Medicare Advantage plan. So you get Part A coverage, you get Part B coverage, you get your drug coverage. So I call it one-stop shopping. You have one card. You're not shuffling around a Medicare supplement card and a drug card and your regular original Medicare card. Again, this is part of the Medicare program, so it's regulated by the federal government. They have to give you everything that original Medicare gives you. And you have to have Parts A and Part B to enroll in a Medicare Advantage plan. And you have to pay your Part B premium to have a Medicare Advantage plan. But what are some of the advantages? Like I said, you get the same coverage, your drug coverage is included. Many of them include, I think, again, all of them in our area include benefits like vision, dental, and hearing coverage. standard coverage, preventative coverage. They're not going to, if you need a root canal, they're not going to pay for that. But they'll pay for cleanings. They'll pay for a year. Most of these plans will pay for a yearly eye exam, that kind of thing. The difference is with these, you usually have a network of providers that you choose from. So when we tell people, if you decide to go with a Medicare Advantage plan, you want to make sure that any provider you're seeing, and think broadly about that. Maybe you see a dermatologist only once every 2 years. But if you see that dermatologist once every 2 years, make sure they're in your plan. For the plans that we have in Tompkins County, you can go outside of your network to see a provider who is not in your network, but you're going to pay more. And we have a spreadsheet if you're interested. And I can share this with Cheryl, or if you want to make an appointment with any of us, we can, send it to you individually and talk to you about these since open enrollment's coming up. And that spreadsheet will show you exactly what your costs are in network, out of network, that kind of thing. Because there's a network of doctors, if you're planning on living 2 different places in the country throughout the year, we usually say a Medicare Advantage plan probably isn't for you. You probably want original Medicare, because you're more likely than not going to be paying out-of-network expenses if you're living half of your year in Arizona, and that can get expensive. Some of the plans also require you to get a referral from your doctor to see a specialist. That's not the case with original Medicare. You can see any specialist you want at any time. But in the case of Medicare Advantage plans, often they'll want a referral from your primary care physician. One thing I really like about the Medicare Advantage plans are it's very predictable costs. So every time you go to the doctor, instead of paying 20%, you have a copay. It might be, depending on the plan, it could be as low as $5, it could be as high as $30, just depends on the plan. So though, every time you go, no matter what your doctor bill is, this is what you're paying. Same thing is, for x-rays. Every time you go, exactly this is what you're paying. It's not 20%. They have a set fee for hospitalization, how many days you're in the hospital, what they pay. So what you can do is, if you're thinking of changing, again, sit down with one of us. We can share all that information with you, and then you can compare it across and see, does original Medicare work well for me? Would I be better off with a Medicare Advantage plan? The other big advantage of a Medicare Advantage plan is they do have an out-of-pocket maximum. So most of these plans, once you hit $6,700 that you've paid out of your own pocket, and a lot of them don't have deductibles. A lot of them you don't have to meet a deductible. And some of them don't even have a monthly premium charge. It depends on what plan you get. So some, you're still only paying your Part B premium, and then you get your coverage without paying another cent more. And should you reach $6,700 and all those copays that you're paying, not for drugs again, only for your A and B coverage, then you don't have to pay another cent the rest of the calendar year. The Medicare Advantage plan picks that up. If you go out of network, so if you're in and out of network, if you've got a doctor in Rochester maybe who is not in your Medicare Advantage plan network, then that out-of-pocket expense is $10,000. You have to have a mixture of both. But I found, at least with some companies, there are doctors in Rochester and Syracuse who will be within the regional plan. But if you're thinking of going further afield, or if you're going to live someplace else part-time, as I said, then original Medicare is better for you. But the Medicare Advantage plans are good options. Now, some sample costs for 2020. Again, Tompkins County, these are county specific. Medicare Advantage plans are county specific. Again, monthly premiums, some have no monthly premium. Others have a monthly premium up to $139. In this case, it's more about maybe your copay is, if you've got a 0 premium, your copay might be higher when you go to the doctor. If you've got a $139 premium, your copay might be lower. You just have to kind of do the math, and we can help you with that. And again, they're private insurance companies, so they can charge what they like, but they all have to give you the same coverage for A and B. And again, as I said, the copays are going to depend on your plan. Could be $10 to see your in-network primary care physician, could be $5, could be $20, depends on the plan. Not going to go over those. Okay, so looking at, again, original Medicare versus Medicare Advantage plan, as we said, for your costs, You've got your Medicare premium, so your Part B premium that you have to pay every month. You've got your deductibles. So if you're in the hospital, that $1,408. If it's Part B you're using for doctor visits and things, it's $198 a year. Then you've got your 20%, what we call co-insurance for any covered costs. So you're paying your 20%. On the Medicare Advantage side, you still have your premium, your Part B premium. Your cost sharing will depend on your plan. You have a copay, a very dependable, you always know what it's going to be. It's going to be the same amount every copay. And your plan may charge a monthly premium or it may not. So that depends. The supplemental insurance, the Medigaps we were talking about, you can, with original Medicare, choose to buy a Medigap to cover some of that, some or most of that 20% out of pocket that you're spending. And as you saw, they can be kind of pricey per month, depending on, your fluidity, your income fluidity. With a Medicare Advantage plan, you cannot enroll in a Medicare supplement plan. In fact, it's against the law for an insurance company to try to sell you one of these. Why? Because you've got the out-of-pocket maximum with a Medicare Advantage plan. There is a safety net. It's kind of a deep safety net, but it's a safety net. So if you choose to go with a Medicare Advantage plan, you cannot purchase a Medigap. Provider access, original Medicare, any doctor you want to see that accepts Medicare, and that's almost everybody. Medicare Advantage plans, you do have a network of doctors. It says here that you must use. As I said, in our area, every plan I've seen will allow you to go out of network. You do not have to stay in network, but you are going to pay more. If you go out of network, you are going to pay more. Sometimes it's only a little bit, sometimes it's a lot. So you can go out of network, but you're going to pay more. Specialists, you don't need a referral with original Medicare. You may need one, depending on your Medicare Advantage plan. Drug coverage, you do have to buy a separate drug plan if you're on original Medicare. If you're on a Medicare Advantage plan, in most cases, and I think all of them in our area, drug coverage is included. Original Medicare, you don't get routine vision, hearing, and dental. You may, and again here, I believe all of our plans, you do get some routine vision, dental, and hearing, and in some of them actually give you a little money toward a gym membership, which is nice. Out-of-pocket max, as we talked about, no out-of-pocket max for original Medicare. You need to have a Medigap plan in order to pick up some of those out-of-pocket costs. But with a Medicare Advantage plan, you do have a calendar year out-of-pocket maximum. And if you reach that maximum, then your plan pays everything for the rest of the year. Now, your choices are not set in stone. And this is another thing that's you always have to remember. You have at least one opportunity every year, sometimes more, to change your mind and to decide you want to try something different. So I already mentioned the fall open enrollment period. Again, that's from October 15th to December 7th. In that period, you can switch from original Medicare with a drug plan to a Medicare supplement plan. To a Medicare Advantage plan. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. You can switch from one Part D plan to another Part D prescription plan. Or you can switch from a Medicare Advantage plan to original Medicare. So you have all kinds of options there. In addition, if you have a Medicare Advantage plan, from January 1st to the end of March every year, and this just started, I think, last year, you can now use that opportunity from January 1st to March 31st to switch from your Medicare Advantage plan to another Medicare Advantage plan, or to go back to original Medicare as long as you're getting a drug plan with it. You can do that. So you have other opportunities. You have at least one, maybe two opportunities. And then there are special enrollment periods. So if you're moving, if you bought a Medicare Advantage plan here, you end up moving to California, you don't have to wait until the next enrollment period to get a Medicare Advantage plan because you've moved. That's considered a special enrollment period. So you can then get a new plan at that time as well. So nothing is set in stone, and that's always important to remember. You're not stuck for life with any of these. Now, very quickly to talk about assistance for paying with Medicare. I'm going to go through this really quickly. contact us if you have questions, because we can really help you with this. There are several different ways to help pay for Medicare. There's Medicaid, Medicare savings programs, there's a few of those. Epic, which I will share something with Cheryl to share with all of you on Epic. A lot of people don't even know this exists. And Extra Help. So let's look at those quickly. So Medicare works with Medicaid. And if you're on Medicaid before you're Medicare eligible, the Department of Social Services evaluates you again. Talk to us about any of that to see if you qualify for that kind of thing. A lot of people end up qualifying for a Medicare savings plan. These can help you pay for your Part B premiums and some of your other out-of-pocket costs. And there's 3 levels. And we have forms we can help you fill out to see if you're eligible to enroll. The income eligibility at the high end, if you're single and you're making $14.26, you're eligible for the last level of a Medicare savings plan. Married is $19.23. If you're making over either of those amounts, depending on your marital status, then you're not eligible, usually. But come talk to us. If you're on the margins, if you're close, come talk to us. But if you are eligible, not only will they help you pay for your Part B premiums and possibly some other out-of-pocket expenses, depending on your income, but they also automatically enroll you in Extra Help, which is help for your prescription costs. So they will help you also with your prescription costs. So that's important to know. So if you're kind of on the margins, please come talk to us. We'll sit down with you and try to help you figure this out and see if we can get you some help paying for some of these costs. In New York State, we're lucky because for a Medicare savings plan, they only take into account your income, not your assets. In other states, they also take into account your assets. So you're kind of lucky in New York State in that regard. Help paying for your drugs, your prescription, sounds like you're on the street buying cocaine. Help paying for your prescriptions, I guess we should say. Extra Help by itself, if you don't qualify for a Medicare Advantage plan, you may qualify for Extra Help for just helping with your prescriptions. In that case, it does look at your assets. But if you've qualified for a Medicare savings plan, you automatically get Extra Help. And then there's something called the New York Elderly Pharmaceutical Insurance Coverage Program. We know it as EPIC. This is a little gift from New York State. It's only good in New York State for residents 65 and older. Only looks at your income. Low income individuals may have a small monthly premium they have to pay. Most people have no premium that they have to pay for this, but you have to reach a certain amount of a certain deductible, and that's based on your income. And once you've met that deductible for all your copays or whatever it is you're paying for your drugs, then Epic might come in and help you pay for part of that. You can enroll for free. Again, unless you're really low income, it's not going to cost you anything. You enroll for free. You'll get an Epic card every time you go to the drugstore. It's not going to pay up front. Again, you've got to meet your deductible, whatever your deductible will be, and I'll share that information. But it will help you. Over time, it could help you if you have a lot of drug expenses. And the other added benefit to Epic is it gives you yet a third opportunity to change your mind about switching from one drug plan to another or from one Medicare Advantage plan to another. So it gives you a third period to actually say, okay, I don't want this Medicare Advantage plan. I picked it during open enrollment. Then I changed my mind from January, sometime between January and March 31st. And now I want to change my mind again. And it'll let you do that if you have Epic. But first you have to have either a standalone Part D plan, if you have original Medicare, or you have to have a Medicare Advantage plan. Unless you have coverage either of those ways, Epic's not, you can enroll, but Epic's not going to work for you until you have that coverage. So when should you see us? Well, you're probably already approached your eligibility. As I said, we're coming up on fall open enrollment from October 15th to December 7th. We get a lot of business then, and we've got a lot of people lined up to help you this year. And in a minute, I will give you the contact information for that. So please call if you would like to, if you're thinking about maybe just reviewing. It's a good time to review what you have, see if there's something better out there for you. If you have any questions about your eligibility or if you need help applying for Extra Help, we meet people all year long, not just during these open enrollments. So we're always available. If you want to compare your Medicare Advantage plans or Part D plans or Medigap plans for Tompkins County, we can also help you with that. So we're available all the time, basically. And in some ways it's better now because we're not in the office. That means I've been meeting with clients on Mondays and Fridays and Tuesday afternoons. And usually when we were in the office, it was only Wednesday mornings. Now we're available. We can pretty much plug you in pretty quickly with whoever you need to see. So don't hesitate if you need help seeing us. As I said, we can offer you unbiased one-on-one health insurance counseling right now via Zoom and phone. This is the contact information. Our coordinator, Liza Berger, is great. What you will do is call her or email her to make an appointment, and then she will set you up with one of us to help you get in touch with us and kind of help you with anything you need. And again, that contact information, Cheryl has copies of the slides, so I will be letting her share that information. In addition to our program at Lifelong hosts us, and this is a Lifelong through New York State, but Lifelong is kind of overseeing this. In addition to that, there are also HICAP counselors at the Tompkins County Office for the Aging. So I'm including that information as well that you can call. The number on the last slide for Liza, that's what we call our hotline right now. That's the hotline for the open enrollment period. But other times you can also just call, or if you don't have that hotline number, you can also just call the general HICAP number, to set up an appointment during regular times. And Office of the Aging also offers the same type of services we do. I've also included a couple of other resources on here for your information. One is a patient's rights helpline if you feel like there's something going on that's not right. The senior advocacy group, they're really, really great. They can help you out. And the Centers for Medicare and Medicaid Services can also help. Some of us can also call on your behalf. Some of us have been vetted and have permission through Medicare to actually call on your behalf and ask questions for you. So ask about that if you don't want to talk to them yourself. Okay, that is the end. I am going to go down here and quit sharing my slides, if I can do that. I'll quit sharing my screen.